what do we see in rhythm? We see that whether the rhythm is fast or slow, is it regular or irregular. Fast or slow, because we need to check which is the system governing. Is it sinus node or any other node, AV node or any ectopic? Then we need to see that if it is irregular or regular. Then we need to see is P wave present, which means that sinus node is working. Then we have to check that if all the P waves are same or not. Does every QRS complex has a P wave? Is there PR interval? Is it constant? Right? All these questions have answers, and those answers are directly going to give us our diagnosis. Then are all P waves in QRS complexes associated with each other or not? Or they're running independently of each other? Are QRS complexes narrow or wide? Are QRS complexes grouped or not? And are there any dropped beats? Right? These correspond to all rhythm abnormalities. And if we check all these, we are going to find if there is any rhythm abnormality present in ECG or not. So, first of all, how do we check the rhythm? To check the rhythm, if there is an, suppose this is an ECG, and on an ECG this is a QRS complex, then this is a QRS complex, this is a QRS complex. You take a piece of paper, right? This is a QRS complex. Similarly, this is a QRS complex, right? And you mark with your pen a point here where there is a QRS complex here, and then here. And if you slide this paper, so that this QRS complex and this line, when you move it forward, and it also corresponds to this, if this distance and this distance is same. So if you slide it this way, right or left, it is this line will always correspond to a QRS complex. That is how you check the rhythm. So moving on to the rhythm abnormalities. First of all, rhythm abnormality is supraventricular tachycardia. Here you go. This is a normal sinus rhythm. Its rate is 60 to 100 beats per minute, which corresponds to sinus node. It is usually regular, which means that this distance and this distance is going to be same. This distance, this distance, this distance, these all distances would be approximately same. There would always be a P wave present, like here you can see, here P wave, P wave, P wave. Then P and QRS ratio is 1. Every P wave is QRS complex. P, QRS complex, P, QRS, P, QRS. Then PR interval. This interval is normal. Like all these are approximately same, and it is not more than normal. Then QRS width, is it okay? And it is going to be normal in normal sinus rhythm. And there would be no grouping and there would be no drop beats. This is what normal sinus rhythm is. Now let's go further and see how other rhythms or rhythm abnormalities manifest. Okay, this is an ECG with sinus bradycardia. Let's compare it with this. In this, the rate is approximately 1 large box, 2 large box, 3 large box, and approximately 3.5. So its rate, when calculated, would come approximately 75 to 80. While here you can see 1 large box, 2, 3, 4, 5, 6, and 7. So when we divide 300 by 7, we get very low rate, right? It is going to be less than 60. So we call it sinus bradycardia. We call it sinus bradycardia because in this we all indicates that the sinus system is working, sinus is working. P to QRS ratio is 1. Then PR interval is normal, QRS is normal, there is no grouping or dropped beats. So this is going to be represented sinus bradycardia, normal sinus rhythm. Approximately everything is same, just is a little bit less. Here we go. This is sinus tachycardia. Compare it with sinus bradycardia, right? 1, 2, these, okay, 1 large box and 2 large. If we calculate the rate, it comes out to be 150. So rate is going to be greater than 100. It is regular. See, all have approximately the same distance. P wave is present in every one of them. P wave, P to QRS ratio is 1. PR interval is normal. QRS width is normal. There is no grouping or drop beat. Okay, so that's how we concluded it is a sinus tachycardia. Okay, now we come to pathologies. Sinus arrhythmia, right? So when by sinus arrhythmia we mean that if you have studied physiology, you must know that with every inspiration and expiration, heart rate changes, right? It is because of the function of vagus nerve and its connection with the lungs and heart, right? Just go on, consult your physiology book and you would come to know. So our normal rate is approximately 60 to 100, right? When the patient is taking the breaths, you will find slightly different rhythm, right? Here you can see that in these ones, rate is approximately same. Then in this one, the sinus rate is approximately same. P wave is present, P to QRS ratio is 1, PR interval QRS is normal. But only difference is that from here to here, patient is inspiring, it is more, and then here patient is expiring. So the inspiration rate becomes more. On expiration, rate this. Okay, this is sinus pause or arrest. Here you can see that rate is approximately same, but it is because here there is no QRS complexes or P wave. Rhythm is irregular because here it was rhythmical, then it was not. Now due to this, it is not rhythmical. If we slide a paper from here to here and then here to here, there is no QRS complexes, so rhythm is irregular. P wave, it is present in approximately all QRS complexes, but there is no P, right? PR interval is normal, QRS width is normal, there are no drop beats or grouping. By drop beat, that there would be a P wave present, but there would not be a corresponding QRS complex. For example, on this ECG, if there was a P wave and it would followed by no QRS complex, then we would call it a dropped beat. But there are no dropped beats, right? But and here from here to here, there is no P wave, which means that sinus node did not work, right? P wave is represented it represents node. So if P wave is not present, it means that sinus node was not working from here to here. It means that it was in sinus pause or sinus arrest. Understood? Coming on to sinoatrial block. In atrial block, okay, let's compare both of these. Rate varies, rate varies. It is irregular, rhythm is irregular. P wave present, P wave is present except in areas of right? Then their PQRS ratio is 1 to 1. PR interval is normal, QRS width is normal, grouping is none, and drop beat is none, right? So this is, okay, there was a brief moment of arrest here. Here there is a block, right? Sinoatrial block. If there is sinoatrial block, rate would vary. P wave is present except in areas of drop beat. Here there is a drop beat, right? So here there is no P or QRS complexes. It is like symmetrical, everything is going on, then there is a pause, and then everything starts. Here, actually P wave is not passed from sinus node, it is called sinoatrial block. Okay, you can just ignore this ECG, this is a bit complex for you. Then this is an ectopic atrial tachycardia, right? In ectopic atrial tachycardia, rate would be greater than 100, PR interval is going to be normal, rhythm is going to be regular because it is ectopic. What does ectopic mean? Ectopic means that it is something sinus node, right? So ectopic other than sinus node, atrial tachycardia, origin is from atrium, right? So in this case, rate would be greater than 100. It would be regular because an ectopic pacemaker is present, and ectopic pacemaker, it beats faster, but it is regular, right? Since sinus node, okay, P wave is present, P to QRS complex is 1, PR interval is normal, QRS width is normal, there is no grouping or drop beat. Here is the actual deal, right? In this lead, as you can see, right, there is an inverted P wave. This is like a bifid P wave, P waves. All these waves are present, P waves are present, but whenever, okay, here you go. See in this ECG. Let's see the rhythm. P wave is inverted. It is not right. Which, when P wave is inverted, what does it mean? It means that current is not following the same axis which it was. If this is our heart, and if from sinoatrial node towards AV node, right? P wave is positive. But if it is not coming from sinus node, it is here, and it is going towards the atria, towards the P wave is going to come inverted, as you can see figures, right? P wave is inverted. See, this thing can be seen in whole ECG. P wave is inverted, right? But P wave is present. It is not that P wave is not present. Similarly, this is magnified as the same thing. So in this, there is an ectopic center, which is not sinus node, but it is an ectopic center, which is providing the rate instead of. Understood? Okay. Next one is wandering atrial pacemaker. Okay, all these ECGs which I'm going through right now, they are really tricky. So if you are a beginner, I suggest you don't really go into the details and just try to catch the gist of it. Okay. So in case of wandering atrial pacemaker, rate is going to be less than 100. There is an irregular rhythm, right? That, okay. So in these cases, rhythm was regular. Rhythm was in sinoatrial block. Rhythm was irregular, but you can see it was irregularly regular. 1, 2, 3, and then same thing continues, and then there is going to be same interval here. So rhythm is irregular, but is irregularly regular. But in this case, in wandering atrial pacemaker, rhythm is going to be irregularly irregular, which means that first of all it is irregular here, then it is not regularly irregular. This for example, in 3 ECGs, this is QRS distance, this is our distance, this is our distance, this is our, so none of these would be any in any regular formation, right? I hope you understand my point. Okay, rate is less than 100, irregularly irregular. P wave is more than 3 morphologies, right? P wave is going to be different. It is going to have different shapes. Like, okay, here you can see P wave is here. Here you can see PR distance and P wave is different. Here P wave is approximately juxtaposed on this QRS complex. Here P wave is somehow here. Here P wave is again here. If we go on the rhythm paper, it will keep on showing this the same thing, that P wave is here. So it means that P wave is moving. First it is here, then it is here, then it is there, then it is there. You know, it is moving. So P wave has more than 3 morphologies. It means that it is going to be wandering atrial pacemaker. PR interval is going to vary. Like here, you can see PR interval is variable. Then QRS complex width is normal, grouping is none, and there is no dropped beat. Understood? Multifocal atrial tachycardia, right? Okay, this ECG is not very important again, but I'm going to show it to you anyways. So this is multifocal atrial tachycardia. In here, rate is greater than 100, right? More than 2 boxes, 150, here again 150, that is 300, that is 150, that is approximately 170, right? So rate is greater than 100. Then rhythm is irregularly irregular. I already explained that it is irregularly irregular. This distance is different, this is different, this is different, this is different, and none of them follow any trend. Then P wave has more than 3 morphologies again, because the atrial, this is multifocal, right? This region is multifocal. It is not sinus node, it is not one ectopic beat. Let me just show you the difference. Its difference with this one, ectopic atrial tachycardia. In ectopic tachycardia, it is irregular. There is just one rhythm due to which P wave is present, but P wave is inverted or has different morphology than normal P wave. In multifocal atrial tachycardia, however, P wave is present with different morphologies. Because there are different morphologies, because there is more than one focus of atrial tachycardia, right? PR interval also varies. QRS width is normal. QRS is not disturbed, right? So its width is normal. There is no grouping or dropped beat. Okay, with this, I'm going to stop these rhythm abnormalities for this lecture. I will carry this on in the next lecture.